My guest today is Dr. Mercy Ofuya, a medical statistician and healthcare innovator with over a decade of experience in research methodology, clinical trials, and digital health. She holds a Doctor of Optometry from University of Benin, a master's in medical statistics from the University of Southampton, and a PhD in medical statistics from King's College London. She is the founder of CupArise, a non-profit addressing breast health awareness in underserved communities through its flagship Mami mobile app. She is also the co-founder and the CEO of Annexis Health, a digital platform improving early cancer diagnosis. Dr. Mercy has also received a number of awards, including the Vanessa Moss Prize from the Royal Society of Medicine in 2023, the David Welsh Award in 2023, and the People's Choice Award. She's passionate about improving early cancer diagnosis and access to care for underserved population. She lives in the UK with her husband and 2 children. Before we go any further, I'll get you to introduce yourself, Dr. Mercy.
Hi, Faith. Thank you so much for having me. It's such an honor and privilege to be here. And it's great to be able to chat with you as well. So,
Okay.
my name is Mercy, and I'm a mom. I've got 2 kids. For me, that's pretty much one of my most important job, all the things I do. And like you said, one of the core things I do is really in everything I do is to bring hope to people. That's something I really enjoy. And in the course of what I do, I lead 2 organizations. And the overall goal is to improve access to people, to patients, and to people in communities in underserved populations, underserved communities, whether here in UK, in developed countries, or people living in low and middle income countries. And that's really cool what I do and what keeps me awake and what keeps my heart burning. Yeah, thank you.
Okay. So, for anyone listening today, what would you like them to take away from our conversation?
Well, I'm looking forward to sharing my story. I'm looking forward to, of course, answering your questions. And I hope that in the course of that, as I share my own heart and experiences, that anyone listening will be encouraged, would be enlightened, and hopefully, inspired. And ultimately, I hope that it will add in some way to their own journey in either encouraging them in what they are doing currently or what they plan to do or how they see themselves in the world.
Amazing. So your career spans from optometry, medical statistics, digital health, innovation. How did this whole journey start? How did that start?
Yeah, I'm smiling because when I think of it, I find it amusing myself. For me, it's really been an adventure. I think the first thing I'll always say is my career has definitely not been linear in any shape or form. However, when I look through it, I see the common thread. And, to answer your question with respect to, how did it start? I'm thinking, okay, how far back can I go? So firstly, I studied optometry. I've ended up studying optometry. I studied optometry because I actually got into the University of Benin to study dentistry. Mm-hmm. And then I failed chemistry my first year. Mm-hmm. I failed it. I had to repeat the year. I think I failed about 5 courses. And then I had to repeat the year. And then I failed chemistry. I remember it's chemistry 104, organic chemistry. I failed it again. And so I was asked to either change department or withdraw from the university as a whole. And so I chose to, change department. And I chose optometry because there was an element of healthcare that has to caring for people's vision, and there was a substantial component of physics. I loved physics and maths when I was in high school, so I was drawn to that, and I felt okay, yes. And I was also thinking of job prospects when I graduate. So so I chose optometry. In the course of doing optometry, my final year, I fell in love with research. That's in terms of analyzing data. Then we just did it with our calculators anyway. And then after my first job, which involved working with an NGO going around providing free medical health care in Nigeria, where I studied, I then decided I wanted to go more into, research, but more from the angle of analyzing data, clinical trials. And so I came to the UK to then start doing masters in medical statistics, then went on to do a PhD in that. Yeah. So that's how it started in optometry, and then I went into research. During my PhD, I worked part-time as well, so I did all that, and then went into, after my PhD, I started working fully. I worked fully in cancer research, and yes, so that's how the transition from optometry to medical statistics. And but all in all, the common thing was always to help people. Like I remember one of the core things I remember from when I was working as an optometrist was being in a village and where we're caring for patients. There was a lady who came in, and by the time we gave her reading glasses, her complaint was really that she couldn't thread a needle. She was a seamstress in the village, and she couldn't thread a needle. And then when the joy on her face, the fact that she could now get back to working and earning, being able to earn a living and not being, with that sort of financial independence, was just, it warmed my heart. And from then I learned that the patient should always be at the core of whatever we do. It doesn't really matter what we do. So even if you work in a bank, or this is my philosophy, or whatever, the security, the manager, or you cook, everything we do affects a human being at the end of the day, whether it's even logistics, even if you don't relate with your customers or your clients, but everything you do affects a human being at the end of the day, and always to keep that at the center of your mind. And so that's something that's really central to everything I've done so far. They may be different, but the central theme has remained the same: to help people, to give hope. Yeah.
That's amazing. So when you said that before you went into optometry, you said you failed about 5 times. How did that make you
5
feel?
courses.
5 courses.
Oh,
yes.
I cried. I cried. Oh God, I cried. I was ashamed. I was scared to go home. I was scared to tell my parents because I felt they would be livid. And for months, I just stayed in school. Even though I wasn't, for a few months, I stayed in school. I was trying to see if I could change without letting them know, use my pocket money to buy the form and everything, and then tell them afterwards. But eventually I had to go home and then tell them. And interestingly, my dad then wrote me a letter telling me how he had also experienced, setback while he was at university.
Oh, that's amazing.
And then it then encouraged, at that moment, I felt seen, and but I would have to say it was devastating. It was, but then I learned something from it, that experience sort of was a wake-up call, and I had to ask myself questions in terms of why did that happen, and how did that happen? Because I haven't been like not like a stellar student from primary school, struggled in my first 3 years of secondary school. Really improved in my final years in high school. Then coming to the first year of university, feeling like, oh my God, I came in with almost all A's, and then I felt ashamed. And then people started telling me stories of, oh, this person, how people had failed out of courses and were doing phenomenally well in the new things they had done. So that gave me courage as well, and I soldiered on. Yeah. But definitely,
So just wanted to ask you, because you said that. So for anyone or any student that's faced that type of challenge, I mean, what would you say to them, or anyone going through some type of challenge, if they feel that they are, they haven't succeeded first time round, because you talked about changing the path. So what would you say to that person listening right now?
I would say the first thing is realizing you still have a chance, not giving up, deciding not to give up. And there are certain things that are said often that people consider cliche.
Mm-hmm.
However, they may sound cliche, but they're actually true. That's why they are said again and again. And there's that phrase of fail forward. If you fail, get up, ask yourself, why did that happen? And then try to figure out how you can correct it or what change can be made. Sometimes it may mean doing something completely different, taking a different direction. It may mean you having to stay the course and doing things. There will have to usually be an element of difference, either something you do outwardly or sometimes even in our self-talk to how you see yourself. And something I learned in university, because even studying optometry still wasn't very easy for me, because there was a time when I realized I wasn't very good at memorizing things like my classmates.
Mm-hmm.
I just wanted to read, understand, and write it down in my own way, not verbatim. But I noticed people who did it explain things verbatim as they were in the notes or in the textbooks got the higher scores. But then I had to become aware of how I study and how I learn and how to, harness that. And there's that element of that. But you have to do the self-work and, ask yourself why things happened and how you can change them. And something I did learn again, and even in uni was, there's a time where you may fail. If you fail a course, there's a tendency to study with your classmates, especially if it's for the previous year who failed you, which is not bad. But sometimes it's something I learned that shifted for me was studying that same course with the best in the other class, in the class that was below me.
Yeah.
That sort of, because I realized they were studying it differently from all of us who had failed it together. And then that really sort of was like a lever that sort of put me forward. Yeah.
That's amazing. So, what first sparked your passion for the global cancer control, in particular with underserved communities? Why did you want to do that?
Yeah. So interestingly, while I was working, so I worked at the Institute of Cancer Research for a few years, and in the process of that, I'd become familiar with the UK's statistics for in terms of cancer, the rates, survival rates, and I knew what things were working. Just broadly speaking, particularly in disease areas I was assigned at the time. I was familiar with the data for the UK, US, Europe broadly. And then after a few years, I decided on my own to take a career break for personal reasons. I just wanted to wake up in the morning, on a Monday morning, and just be mom and nothing else for a period. I told myself, I spoke with my husband, I had his support. And I just told myself, I'll just be for, like 6 months, and then I'll go back. Medical statistician, biostatisticians, they're usually, getting a job is not difficult, especially when you're experienced. So there's usually high demand. So there wasn't that fear of, how will I get back into the workforce? I just told myself, I'll take out 6 months, take this career break, get a breather. Because I had my daughter just as I finished my PhD and I started working. So I never really took a proper break in a sense. So yeah, so I just told myself I'll take a career break. And then in the course of that, I was at home and then came across the news that someone really close to our family, who I call, my friend, her name's Felicia, and she had passed away, due to cancer. And that really touched me because she was someone I really loved I really looked forward to meeting, during family gathering. She was such a sweet lady. I didn't even know she was ill. And by the time, we start hearing backstory, she wasn't ill for a long time. So, and like one of the skills I have is in terms of doing systematic reviews. So, well, here I am sitting at home with time on my hands. I started researching, cancer, why, what's happening. I wasn't familiar. I'm originally from Nigeria, and I wasn't familiar with cancer stats in Nigeria. And so I started reading things, articles, research papers online, and I found out that while you have, say, for instance, in terms of like early stage breast cancer, where you have 80% of patients, so that would be 1810 patients, say, surviving for up to 10 years, after treatment here in the UK and in the US. People who live in places like Nigeria and Africa and similar countries, what we had was 8 in 10 of those patients actually dying. So the mortality rates were pretty high. So the death rates were pretty high from breast cancer. Essentially, significantly the opposite, and I was shocked. And I have to say, in a very naive way, I said, okay, we have to try and solve this. So I called up my a friend of mine who she's a behavioral scientist, because I felt it had to do with maybe if we could get people to seek help early and to try to improve early presentation, to get to the doctors early, and then if they're diagnosed early and they start treatment early, and to increase the chances. That's what the evidence showed. So, and I felt if that was the case, then how do we get women to do that? And so I called my friend Nim, she's a behavioral scientist, and I called my cousin was working in the US, also in global health at this time, and pulled together a few friends, Brian, different, who pulled all that people, Shay, I'm calling their names now because it's so still very fresh and remarkable. Kelechi, several friends, came together. I was pestering other friends, if I don't remember all their names now to call them, and they were volunteering that time. We're just brainstorming what should we do, and so that's how it started. Very naive. We just thought, we'll just do this one-off project and sort of sail into the sunset and move on. And then people say, you need to give it structure. You need to do this, and then I needed to read some more, attend conferences, really understand what was happening. Spoke to several doctors working in Nigeria and in other countries, emailed people, got on phone calls with people I'd never met, and it was during COVID by this time. And so I was doing a lot of things online. That's how I sort of stepped into it. So I have to say it was naive. I sort of stumbled into it. And then, but in terms of my why, was really, how do we help people? How do we give people hope? How do we let them know that it's possible, that if detected and treated early, that their chances of survival were high, depending on the cancer type, obviously. And and irrespective of where they live, how do we get help to people? Or how do we help people access help, support people in accessing help, essentially? So that's how I walked into it. Yeah.
Because one of the things you said in terms of like behavioral, coming, within our society in Africa and, for example, in Africa and in Asia, there's always some type of a stigma, isn't there, when people so they don't want to talk about it because of the shame or did you find that with the people you might have spoken to, or?
Yes. So in the course of, as we started work, one of the first things we did was we did a podcast. It's called CupArise podcast. It's freely available for people to hear. And then we started Mami. Over time, we developed Mami app with a team of volunteers. And in the course of doing that, we then, of course, started engaging with people. And we realized we started getting messages on the back end. So either through Instagram, people try to, they were DMing our page, DMing us, or sometimes DM me or DM one if of my volunteers, or even other people who were sharing the app saying, okay, I noticed something on my breast, but I don't want to go to the hospital yet. Who can I talk to? Or I don't want anyone to see me. Or I know people in that hospital, so I don't want to go there. So there was that shame. And that was one of the things we're trying to do in terms of closing that gap between noticing the symptom and actually taking the first step to seek help. And even I think a few weeks ago now, I came across a skit on Instagram where a mom was interrogating her daughter's boyfriend or someone she had brought home or someone she was dating.
Yeah.
And the mom was asking the guy, does anyone in your family have cancer? And that struck me. I mean, people just laughed, in terms of comments. I went through the comments and no one actually picked on it. And I thought, so this is something that's sort of literally seen as this is some of the questions you have to ask people. So that's one of the reasons people don't want to seek help or let people know what they're going through, because there's that shame, there's that stigma to the family, and then there's also fear. There's a lot of fear, and that is really, in terms of fear and other things, that's actually universal, irrespective of where people live or where they're from. Yeah.
Okay. So CupArise was born to address the breast health awareness gap.
Yes.
What reality did you encounter in the communities that confirmed that this work was urgently needed?
So yeah, so we spoke to a lot. We remember when we started out with lockdown. So I spoke to people. We were speaking to women. We spoke to people who had relatives who had passed away due to breast cancer or some other form of cancer. Then, apart from just speaking to people, one of the things that came up while we're speaking to people was, I don't even, apart from the lump, I don't know what else to check for. And then everyone hears of the breast lump, but there are about 11 other breast cancer symptoms. And so some people didn't know to check for them. Some people talked about how they had been dismissed by doctors. So sometimes even doctors at primary level need to be more aware of, particularly in low and middle income countries, even here in the UK, need to be more aware of what these symptoms are. And also understand that, because here, for instance, in developed settings like UK, let me speak specifically for the UK, cancer screening, breast cancer screening, usually from 50 to 70, that's about the age range where you get invited for breast cancer. However, in minor ethnic women, you see breast cancer, you see a lot of situations where you have breast cancer patients in their 30s and 40s. So there was that need for the awareness. There was, we read things, and then we did a survey for people living in Nigeria, because our initial target audience, our first target audience was Nigeria, and we've broadened that. We've done a pivot now. We've broadened that, and we're even coming into the UK now. Well, when we started out, we're just focused on Nigeria initially. So we did a survey. We did that online. And noticed most of the patients had never, so they've heard of breast cancer. Some of them had even matched on campaigns, but they couldn't tell you what the breast cancer symptoms were. Most of them just knew the lump. Most of the women had never gone for screening. They didn't know to do a monthly breast self-exam in terms of checking their breast. And we then had started encouraging women to say, just imagine think of it like, when your body temperature is normal, when you have a fever. Mm-hmm. In the same way, you also know when your blood pressure is high or low, at least based on the readings. Yeah. So the purpose of checking is not, I'm checking, looking for a symptom. Just become familiar with what your breasts look and feel like normally. So that if there's a change, doesn't mean you have cancer, but if you notice a change, then you can seek help. So that's so those were the things that came out of and then some people were too scared to check. I spoke to some nurses who, even here in the UK, who were like, it just feels uncomfortable to check my breast, or to feel for. And I said, me too. I feel the same. It felt uncomfortable for me too. But it's something with time, you get used to. That's part of the behavior part. Yeah. So behavior change.
So
and seeking help. Yeah.
Yeah. So on the platform, it's also kind of educational, is it? Literacy for people to learn how to do the checks, or?
Yeah, so there's a video on the platform that shows women how to check. We've translated it into other languages. We're still going to translate into, we started with Nigerian, the main Nigerian languages. We're still going to translate into more languages. And then there's also visual guides of what to check for. We're also conscious of when you go online. I mean, now there are more skin tones. When we started out, there were only mostly skin tones, not for Caucasians. So we're conscious to do, ensure that our images were more towards the dark brown, dark or brown skin tones for breast cancer.
So with the apps you've got, I know there's one called Mkono. Is it Mkono or Mkono?
Mkono.
So what does that mean, and what is that app about?
Oh, so Mkono okay. So Mkono is a digital platform which was created under the second company I lead, which is Annexis Health. So Annexis was born, interestingly, from the need for Annexis, let me put it this way, the need for Annexis came about when I was engaging with a lot of the oncologists, researchers, and in fact, the various health professionals working in cancer. So I recall it was in 2023 when we first launched Mami, that's the Mami app. I was speaking with oncologists and how, we're trying to get women to get to report early, present early, then if they had breast cancer symptoms, so they could be examined. And a lot of doctors, whether it was those working in breast or pediatrics, or so whether they were adult cancers or pediatric, they were all and different cancer sites, they were all complaining about the same thing. But like, oh, Mercy, that's all. Yes, it's great. We want the patients to present early and we want the patients to get diagnosed early. But a phrase they kept using was my pain point. Something as in my pain, I wish this, I need the patients. We lose the patients after they've come the first time. We can't reach them. We don't know where they've gone. We don't have a way of tracking them. And sometimes we send them out to do diagnostics to the lab in the hospital. They go somewhere else. Then they bring some tests back. They have no way of engaging with the radiologist, in the center they've gone. Sometimes they start treatment, they don't complete their treatment. And really sticking to the regimen for treatment in cancer is really crucial, particularly for some cancer types. You really have to stick to not just the dosage, but to the regimen, in terms of the timing and all that. And to ensuring they stick to the appointment, and even more importantly, that they actually complete. So even when appointments are made, they complete treatment. And a lot of patients, a substantial number of patients, we're not completing treatments for different, really valid reasons. Sometimes it's cost, sometimes it's fear, sometimes it's, by fear, I mean, by the time they've gone home and then people know they're experiencing going through treatment, and they tell, don't go back to that hospital. So happened to this person or that person, tell them stories, they get scared, they don't come back, or they start experiencing side effects, which is really common. And can they experience something maybe severe, maybe mild, whatever the state, and that discourages them sometimes from going, logistics, distance. So there's a myriad of really complex problems. And as they kept saying all this, the one request that kept coming through, even after the conference via email, was, can you extend the back end of Mami, as in beyond just people, beyond the breast self-exam? Can you figure out a way to help us track the patients from the community to the hospital, back to the community? And I remember one researcher specifically used the word 360, just create that 360-degree thing. We want to be able to track, we want to know where the patient is, we want to have the full picture of the patient from beginning to end, and even after treatment. Mm-hmm. And because, again, a lot of people, there are not very many cancer centers in Africa. Mm-hmm. A lot of people have to travel very long distances. So they wanted to be able to communicate with them wherever they were. And the short version of the story is, I then started brainstorming with a colleague And we started thinking of, how do we go about solving this problem? And then with time, they invited me over to Malawi to understand the problem. So we got to engage with the healthcare workers, the community healthcare workers, the health professionals in hospital, and as well as the some of the patients through focus groups, which I just shadowed. And I got them to explain the problem and what a solution would look like. And based on what they said the solution would look like, we built Mkono. And Mkono means arm in Chichewa, which is commonly spoken language in Malawi. It also means helping hand in Swahili. So essentially, holding the patient's hand, giving that arm of support through the entire cancer journey. So we named it Mkono. And so it's the digital platform that ensures that it educates community health workers on identifying patients with cancer symptoms, monitors their tracking so we can track the patients in real time, sends them SMS reminders for their symptoms, and then even when they're experiencing side effects, they can report their side effects to the doctors no matter where they live. And we've launched in Malawi. Yeah. So.
Amazing. So this is also for children, male, female, everyone.
Everyone.
That's amazing. And how was that received over there?
Yeah, so we co-designed it with them. So they already took ownership right from the ground up. So we co-designed it with them. I pulled together a new team to work on this, and then we co-designed it with them. I kept going back to Malawi. We have been to Malawi several times now. My husband calls it a third country, and for to Malawi. I really enjoy being there and then getting their feedback at literally every item on the software, asking how they want it, what they wanted to do. So by the time we launched it, it was something they were already embracing and still telling us. And it's always an iterative process of building anything. And a lot of the lessons I learned from Mami, I could put into developing Mkono.
Amazing. So you've actually received a lot of major awards for innovation and entrepreneurship. What do these milestones mean to you beyond recognition?
Okay, so beyond the claps and the yay and the excited moments, they actually placed me in a state of deep reflection. They're testament to the work that has been done in a way. They're encouraging, but at the same time, they often, this is for me though, they really make me really sit down quietly with myself and ask myself, why am I doing this again? And what next? So they often tend to put me at a junction in a sense. So it's always like, reflecting on what has been done. And then where am I now? And then where am I going to? I'm like, okay, yes, this has been one. This is great. But then I put it behind me and just keep moving forward. So it helps me reflect on it. I try not to focus on them too much because I think I only remember them when I'm reading my bio. When that's then I'm like, oh yeah. There's so much more ahead, but it also then reminds me of the fact that people have supported me to this point, and reminds me of why I started it in the first place, and I have to get to that destination because it's still ahead. Yeah.
Okay. And looking ahead, what would success in cancer care for underserved population look like in the next 5 to 10 years? What do you think it would look like? Do you think it would have progressed for the better?
Oh yes, definitely. There's so much work has been done. There's so much improvement, but there's still so much more to be done. My dream for cancer care in underserved populations, if I was to say it in one word, I would say it's access. So access, and not just access, timely access. Timely access to robust care, timely access to finances, particularly in countries where they have to pay out of pocket still. We hope in 10 years, universal health coverage will be much more widely available. But at least between now and say 5 years, I hope that, people are able to access the funds they need in terms, so that along the entire cancer continuum, both from the research angle of things, I hope that, there's that advances even more. A lot of advancement has been made, you see, but when we look at underserved populations in particular, being able to access those drugs, those medications on time is critical. So, for example, I'll give you context in a country like Malawi, where the government essentially pays for cancer care or covers cancer care, and you still have the high mortality, high death rates from cancer because of late diagnosis. That's very saddening. And those are when I think of that, when I have to spend late nights doing things or working, it really strengthens me to go forward, because I can't sit on my hands. Ensuring that that child is able to get to the clinic on time, essentially stop needless deaths. So so access to care, and that they're able to actually complete treatment. So it's not just starting, but complete treatment, and access to other support, because it's not just the medicine. There's so much support needed, apart from finances. There's also psychosocial support that's required, because life beyond cancer still needs a lot of support. People think, once they've completed treatment, but they experience so many other things that they need support and help for, even medically. So being able to access, for people to be able to access that comfortably in those settings, for me, it's, oh my God, I don't know how I'll feel when it becomes the norm. That would be amazing.
Yeah. So what would you say the lessons you've learned throughout all this process?
Oh, okay.
And also, how have you juggled everything, also being a mom, being like a scientist and being a mom and doing all these things?
Okay, I'll take the first question. I'll take the first
Sure.
the first question in terms of how. What have I learned? I've learned many things, and I've learned from the things that have worked and the things that haven't worked. I've learned from the things that I've failed at, and from the things that I excelled at the same time. And it's often important. I'll speak first on the things that worked or excelled at. It's important to also because sometimes some things happen and everything works out great, and you get this award, or you get something, or something pans out. It's important. Sometimes we get so happy in those moments and don't actually take time to take note of the things that led to that, so that we can replicate it, or work on it to improve it for the future. So it's important to do that. But even more importantly, from the things that didn't work out, that I feel that some of the mistakes I made, I'll mention about two or three, and that first come to mind. So one of the things I've learned was learning I found out I was too slow in taking decisions. And then I had to learn that they're what they call the one door and two door decisions. So one door decisions are things that I should spend more time on, because you can, once you take them, it's hard to reverse them. So, for instance, maybe the structure of the business, the legal structure of the business. So, those kind of decisions you want to take time to before making those decisions. Then, but I found I've spent a lot of time on two-door decisions. So things you can easily change. So maybe like a logo, don't waste time on those kind of things. That isn't even the brand. That is just a symbol of maybe what the brand encompasses. But it's not the things too. So then asking myself over with time, is this a one-door decision? Is it two-door decision? And then just taking decisions as quickly, as efficiently as possible. And then something else I learned was not to be afraid to take the first step and not to be afraid to make mistakes. You learn on the way. It gets better, it improves. Sometimes we want the whole picture, we want it to look picture perfect. For Mami, this is we updated the design of Mami. I think it was last year, or no, we started that in 2024. It was nothing like what we started with. By the time we launched we updated it fully early last year. It was nothing like how we started in 2023. I mean, when I look at that, it looks like, oh my God, this is how we started. But it improves, but you just have to start. Yeah. The same thing with Mkono. I remember how we started Mkono. I was going through a list of expenses, things we had done, and I was wondering, oh my God, we use this platform. How could we think that it could work on the first platform we tried to build it on? Then we quickly realized, I think after about 3 weeks, that it wasn't the right platform, and then we moved to another one. But then if we didn't start, we wouldn't have known that. And then engaging with the community health workers, they gave us, feedback. Oh, we don't want to click on it. We want to tick boxes. We don't want this. We don't want to swipe left. We want to click. Really, it may seem salient to you, but it's crucial to the user. So just starting and not being afraid. And in terms of even hiring people, whether contractors or team members or even recruiting volunteers. And then, we had to learn to, what's the phrase I use now? Hire slow, fire fast. But understanding the right fit. So those are things. So I learned from the mistakes I've made as well. And I know that I will still make some, in the future, but the cautious thing is to learn from them. And then, of course, not to be afraid in taking steps and taking decisions and action. Yeah.
Okay. And what 3 values do you live by?
Excellence, integrity, kindness.
Amazing. And
you haven't answered your second question, though.
Oh, okay, yes. Yeah. Oh, with the kids. Yeah,
with the kids. Yeah. But I was scared to start, even Mom, in terms of like throwing myself, when I realized it needed more of my time and more of my effort, and moving from being a freelance, because then I started doing freelance statistics work for people, even pro bono sometimes, and then moving that into Mami, and then again, to Annexis, and as Mami became more, it's non-profit, and Annexis was the main company I work on now. It's at the very beginning, I think this was in 2021 as the world was opening up gradually. I remember being scared to start, or with family support, and then just being realistic with myself with what I could do. There's this phrase, I'm going to sort of address this a bit, if that's okay. When people talk about, you can have it all, you can have it all. And a lot of times we think about, some people say, oh, you can have it all. And then there's the other factor of, oh, you can have it all, but not at the same time, because life is in seasons. And as a woman, things are in seasons. And I do believe that things are, you can have it all, but you have it all in different seasons in certain ways. But I'll give that more context in terms of a lot of times if the conversation is focused on the having.
Mm-hmm.
But in my opinion, why there seems to be controversy when people have that conversation is actually, I believe, because we all think that what we define as our all is the same thing. What is all to me may not be all to someone else. So, for instance, when someone says, "Oh, you can have it all," and I have a nanny, and the person has a nanny who maybe picks up the children, and they're able to go to work or do different things, and for someone else, and that is fine as long as they're able to juggle everything, get home, prepare the meals. But for someone else, all maybe they want to pick up their kids themselves.
Yes.
So we're not actually talking about the same all in that sense. So it's actually fine asking yourself, what does all mean to me? How much of it am I willing? Because there will always be trade-offs. I have to travel for a conference. I have to travel to Malawi. I have to travel for a meeting. I can't attend. I may not be able to attend certain events. But the question is, which events am I willing to not be able to attend? Yeah. Which days am I willing to not be able to do the school drop-off and the school pick-up? So it's what does all mean to you as an individual is what I often ask, and what are you willing, what trade-offs can you make, or are you not willing to make? And then you have to make peace, with yourself, whatever decision you come to and what you're comfortable with, and then just go with that.
Excellent. And I think that's an excellent answer, actually, because it means different things to different people. You can compare yourself to what other people are doing, and that's where the mistake comes. Because we want to do it exactly how Jane next door does it. It looks like she everything is so easy to her, and but it's not always the case. Like you said, some people might have more support than others.
Yeah. So yeah.
So as someone like yourself on a mission to improve access to cancer care, what legacy do you hope your work will leave, and how can listeners support or get involved?
Oh, yeah. Oftentimes when I hear the word legacy, I start I pause because I'm like, oh yeah, I'm so young. But I see I remember when my mom, I'm just going to say the story. When my mom passed away, I looked around and I realized the greatest thing she actually left was the people she had touched in one way or the other, the people she had helped, and us and her children, whom she had raised, the four of us. So I'm the oldest of, I have the three siblings, or four. I'm the oldest of four. And now in the age of their coaches, their mentors, I realized she had been my lifelong coach and mentor. I still hear her voice in my head for a long time. So in terms of legacy, I believe that would be the people that through the words, my friendship, my work, that my heart, have touched in some way, shape, or form, directly or indirectly. At the end of the day, I believe that's what my legacy will be. And yeah, and it's really hard to even know what one's legacy will truly, really be. But if I had to describe it, then that's what, that I made my actions, my acts, my thoughts, or the things I did or lived by, made an impact in someone's life. That'll be everything.
Thank you so much for this conversation. I will leave your details and the audience can actually find you on Instagram, LinkedIn, etc. Thank you so much again for this conversation.